Today we're talking about a study that helps us better understand a gene called NR2E3, which is linked to a form of retinitis pigmentosa known as RP37. In this study, doctors found a new genetic variant in 3 siblings who had vision problems from a young age. This variant is called Val118Lu, but you don't need to remember the name. What matters is that researchers have seen that this variant can cause the disease, and that's why they now consider it likely pathogenic, meaning it is probably responsible for the retinitis pigmentosa in this family. The 3 siblings had typical RP symptoms: difficulty seeing at night, loss of peripheral vision, retinal changes visible on imaging tests, and very low responses on the electroretingram. Each sibling had the disease with a different level of severity, which is quite common in inherited retinal conditions, the same mutation, but a different progression in each person. The parents were healthy carriers, which confirms that this form of RP is inherited in an autosomal recessive way. You need to inherit 2 altered copies of the gene for the disease to appear. Why is this study important? Because when a genetic variant moves from we don't know if it causes the disease to it probably does, that helps many families. It leads to a clearer diagnosis, more accurate genetic counseling, and allows more people to be included in registries and future clinical trials. This study is not a treatment, and it does not change the course of the disease today. But it does strengthen the scientific foundation we need so that, in the future, therapies targeting the NR2E3 gene can be developed. In summary, this clinical case confirms that the variant found in these siblings is related to RP37, and it provides valuable information for patients, families, and professionals. It is one more step toward more reliable diagnoses and toward a future with more personalized treatments.